We're rolling.
Okay, so let's start with your first experience with tumor treating fields, and explain what it is and what's called, and your first exposure to it.
Sure. So I'm a radiation oncologist, and I treat patients primarily who have cancer in the brain or cancer in the lung. Tumor treating fields was actually first introduced for patients who have glioblastoma, which is the most aggressive tumor that we see in the brain. This was studied in...
The pen is crooked. I just noticed.
Okay. Killing me.
We'll have your title. You don't have to say, I mean, we'll have your name and title. Go ahead, and we'll try it.
So I'm a radiation oncologist, and I specialize in treating cancers in the brain or in the lung. Now, tumor treating fields, or TT fields, were actually introduced in patients who have aggressive primary brain tumors called glioblastoma. Now, this is a disease in which the standard treatment is maximum safe surgical resection, and then radiation therapy and chemotherapy. And then tumor treating fields were added on top of this, and they were shown in a phase 3 randomized controlled trial, which is really our high level of evidence for us in medicine, to provide a substantial survival benefit. So I've had experience in using this medical device in patients who have glioblastoma. In addition, at our cancer center, we also have ongoing research studies using this device in patients who have non-small cell lung cancer, as well as brain metastasis. And so we have experience using this device in the clinical setting and in the research setting. This was recently approved for patients who have malignant pleural mesothelioma, and it's used very similarly to in the, So this was recently approved for patients who have malignant pleural mesothelioma, and its use in these patients is very similar to how we use it either in patients who have glioblastoma or in patients who have lung cancer.
Tell me how it works. I mean, after, I believe you say after chemotherapy, then you can explain how you show them and they take it home. Go ahead.
So tumor treating fields, or TT fields, is a device that a patient wears for at least 18 hours during the day. We know this from prior studies, for example, in the glioblastoma universe, in how the treatment actually works alone or with chemotherapy. Now, specifically for patients who have malignant pleural mesothelioma, the device was studied in addition to or given with chemotherapy. Now, chemotherapy is really the standard of care for patients who have unresectable malignant pleural mesothelioma, and this device is something that they wear in addition to the chemotherapy cycles that they receive. Once they've completed their chemotherapy, this device is then worn continuously afterwards, and then will be used to try and control or keep the cancer at bay.
Tell me as best you can as best we can describe how it works specifically.
So TT fields actually provide alternating electrical energy, and that's guided or targeted to the area in the lung where the disease exists. Those pads that deliver the alternating electrical frequency and energy, they're placed on the patient in a very specific position. Those positions may differ between patients based on the location of the disease or even based on the anatomy of the patient. Once we've designed where those pads should be placed, then that patient continues to wear the device with those pads typically in that same position. They're moved a little bit between their treatments to allow for some skin sparing, but otherwise those pads remain in that same position.
I know you spoke about this, I think you mentioned the trial, or the trial we were looking at. Can you tell me the results and the promise? I know if you can speak a little bit to the seriousness of mesothelioma, obviously, and how this may increase survival rates, if you can speak to that.
So malignant pleural mesothelioma is a very difficult disease to treat. We see approximately 3,000 of these cases in the United States diagnosed annually, but potentially 16,000 of them diagnosed globally. So this is a worldwide issue, more than just a U.S. issue. Now, we know this because in the U.S. we've transitioned from our culture of using asbestos in the environment, but this transition has not occurred in the rest of the world. The trial that was performed was not performed in the United States, but is really a key and seminal study for using this device. In this trial, 80 patients with unresectable malignant pleural mesothelioma wore this device in addition to receiving the standard of care chemotherapy. We saw that there was incredible response rates. About 40% of patients had a response to treatment, and the percentage of patients who had what's called a clinical benefit, who had either stable disease or a response to treatment, was 97%. This is a very difficult disease to treat, and there have been very few advancements in the last 15 to 20 years for this type of treatment. And so this has been very exciting for us in the medical community.
Let's talk about the case, the patient, without naming him, of course. Tell us about his age and his diagnosis and how he came about using the tumor treating fields.
So given that malignant pleural mesothelioma is a rare diagnosis, all of these patients are discussed in a multidisciplinary tumor setting. This is a conference that we hold with all the physicians that are specialized in treating thoracic malignancies, and that includes radiation oncologists, surgeons, and medical oncologists. This patient actually came to light because he was diagnosed with malignant pleural mesothelioma and was deemed to be unresectable by the surgeon. Therefore, the standard of care for these patients would be to offer them standard chemotherapy. When we discussed this case at Tumor Board, we were able to provide an additional option for this patient in addition to just chemotherapy. And that's not radiation therapy, which is what I traditionally prescribe, but it was actually the use of TT fields. We saw this patient for a consultation. We discussed the option of this treatment and what enrolling on our institutional protocol would mean. This patient elected for their treatment, and they have started their therapy.
And can you tell me his age and how he's doing and his outlook, well, as best you can?
Yeah, it's hard because he just started his treatment, so we can't say anything about. Yeah.
Can you
He's just started it, so.
So, and did he actually?
He put on the device, yeah.
And can you tell me a little more about the patient without naming him?
Yeah.
Retired or his age?
So our first patient is a retired gentleman who is still very active and wanted to maintain his activity for as long as he can. Given that chemotherapy is only given for a certain number of cycles, he was looking for a treatment that could potentially provide some more durability in disease control. Now, we've learned from the STELLAR study that was done that the progression-free survival, or the time that the patient is alive with the disease still under control, with them not progressing, is longer in the STELLAR study than it would have been in the historical control population. It was longer by a couple of months. So this patient sought us out for that opinion and for that treatment. The patient has started his treatment and has so far just developed the skin toxicities or skin side effects that we know are associated with the device.
Tell me about the prospect of using this system or continuing for these serious cancers, or maybe is there a prospect for using this system in lesser stage cancers or other forms of cancer?
So we're doing research in using this type of treatment in a variety of cancers. And we're using it in patients who have brain metastasis and, again, in patients who have lung cancer. For mesothelioma, a majority of patients that we see now have unresectable disease, and so their treatment options are quite limited. This is a treatment that is used in addition to chemotherapy that is more a local treatment. And that's really the issue with mesothelioma. It's a locally aggressive process or disease entity. So this allows me to provide an extra treatment option that really is not available to patients when we can't offer surgery or we can't offer radiation for those patients.
Anything else that you want to say? I mean, the big takeaway from this is from this new system, and I know mesothelioma is still fairly rare in the United States, but what's the big takeaway for the general?
I think the big takeaway from the use of this device is that although mesothelioma is a rare diagnosis, it is a pretty devastating diagnosis. The median survival from the time that you were diagnosed is actually very short. If we look at the STELLAR study for this, the estimated historical control, the survival for those patients, was just over a year. And if you look at the patients who were treated on that study, their overall survival was about 18 months. So this provides us an exciting new avenue for providing a treatment for those patients.
All good?
Yeah. plans to put in more patients?
Yeah, we're hoping to put more patients on this treatment.
You
So.
want to say that?
Oh, sorry. Okay. Oh, sorry. I thought he was asking me a question.
So, yeah.
All right.
No, yeah. Any plans to expand this this treatment? And I say maybe beyond mesothelioma, which is already glioblastoma is already there. But go ahead.
So we're excited to be offering this therapy for patients who have malignant pleural mesothelioma. Typically, these patients are seen at large multidisciplinary centers where their care can be provided across multiple physicians who specialize in treating thoracic malignancies. One of the particulars about using this device is that it was approved under a specific pathway by the FDA, and so patients treated with this device have to be treated by trained providers and at their institution have an ongoing protocol in which those patients are monitored and their toxicities are analyzed. Now, we're very fortunate in that we were one of the first institutions to have this protocol, so we're able to see patients really from all over the country and hopefully all over the world for this type of treatment, but it will be localized or available at very few centers.
I'm glad you asked that. That's great.
That's great.
Yeah, it's great. Anything else? Anything?
The Miami Cancer Institute, I haven't heard you say, the Miami
Oh.
Cancer Institute is just at the forefront.
Yeah,
Something
okay.
like that.
Just,
It's a privilege.
Okay.
Something like
No,
that.
that's-
Okay.
Something to thank them, though, special to Miami Cancer Institute.
So at the Miami Cancer Institute, we specialize in taking care of patients who have very complicated diagnoses or even very rare diagnoses. The benefit of our cancer center is that we're really able to provide multidisciplinary tumor care for these patients. We have physicians that have specialized expertise in really all aspects, and that could be surgeons, medical oncologists, radiation oncologists, but also things like cancer rehab physicians or cancer support services, things that are sometimes overlooked in cancer centers. And we all work together to provide the patient one treatment plan or plan of care which is personalized to that patient and is really hopefully the best medicine can offer them. Okay.
Now for the.
Oh no.
That's it? No, that's it. No,
Oh,
that's
okay.
it. The hard part of your day is
Oh,
going
the hard
back
part.
and checking on
Yeah,
your
now I
phone.
got. That's what I got. That's what I'm thinking about the
This
whole
is the
time.
easy part.
Yeah.
That was great.
I'm good with. Yeah, I'm good with this.
No, I'm great.
So we'll start from scratch, sorry, now this is,
Ready?
go ahead, when you're ready.
So I'm a radiation oncologist, and I specialize in treating. Oh,
You can. The things that seems like someone actually RSVP the room for another meeting.
Okay.
So there seems like to be a conflict.